First and foremost, we wanted to offer the chronic care management services to help the patients of our community. Chronic conditions such as diabetes and hypertension are very prevalent in this area. Access to patient education resources, however, is very limited.
And another reason for providing chronic care is we wanted to try to help educate patients more about their chronic conditions and to be a go-between with their physicians in between their doctor's appointments, which normally occurs about every 3 months.
Right, and another reason we wanted to offer the service is from a revenue standpoint. The days of filling prescriptions in a small hometown pharmacy and surviving, I think, are gone. I think, as an independent pharmacy, we have to adapt to the current market and innovate to survive. So, any service that we can offer to patients that is, number one, patient-focused, patient-centric, however, also adds a source of revenue to our business is more than welcome. So the typical patient is enrolled and consented in the chronic care management program by their provider. We then call that patient to schedule their first meeting with our pharmacist here in our pharmacy.
So when the patients come in for their first meeting, they bring all their medications with them. We sit down, we go through their medications, make sure they understand what they're taking, why they're taking it, and how they're taking it. And then also we talk about proper storage and disposal of their medication. And then when they leave that meeting, we have a list of all their meds, and we also schedule the next follow-up appointment with them.
And you'd be surprised at that list of all the medications that their patients are on. A lot of times their provider has no idea that they're on certain medications. We have some patients say that they were watching Dr. Oz and he recommended a medication, or their neighbor told them to take a certain medication. And these are things that are important that the provider knows that the patients are taking. So that's the first thing we do is we contact the provider and we make sure their medication review is updated. After that, follow-up appointments after the first in-person appointment are typically every 30 days. Many patients choose to have this over the phone because of transportation issues. However, I'd say at least half of our patients actually prefer to come back in the pharmacy every 30 days and have that human contact.
I think one patient that comes to mind would be our patient from yesterday. Patient was diabetic, also has hypertension, and when he came in, he had his insulin with him. All of his pens were at room temperature. So we obviously educated, about leaving one pen at room temperature and storing the rest in the refrigerator. I think another thing is I found out that his pen needles that he used to inject the insulin, he was reusing those multiple times. So I, educated him about a clean needle each time when he did his injection. I also found out when he's testing his blood sugar, he's using the same lancet multiple times to prick his finger.
Yeah, and the patient actually experienced vision loss because of his diabetes, and he couldn't read on the insulin box where it said refrigerate. And this whole time he's been on insulin, it hasn't been refrigerated, which I'm sure led to an elevated A1C and blood sugar and everything else. So another thing we did, the patient we found had never tracked his blood sugar levels. So we printed a log and delivered it to his house, and every month that patient fills out his log and he comes back in, and so far we've definitely seen some improvement, and he enjoys doing that too. Now he understands how to help his condition. The advice I would give to other practices regarding chronic care management is go ask your local providers, particularly primary care providers, if they are doing the service. I've talked to many independent pharmacists that say the providers are already doing it, and they're not. They can't be. If you look at the statistics, chronic care management is severely underutilized. Medicare, even lessened some of the requirements to participate and bill for chronic care management this year because so few people are actually using it. They see the value in it. We all see the value in it. Patient education is needed tremendously right now. So go ask your providers. It's very good for the patients. It's a great asset to have, both in terms of patient care and also as a business for reimbursement on both sides. You know, the margins in pharmacy, we all know, are smaller than they've ever been, but the margins in primary care are doing the same thing. Everybody's seeing it. So a service like this has been welcomed by both sides.
The chronic care program for our practice has been developed to further provide resources for our patients that have multiple medical problems. We have partnered with a local pharmacy to help us do that. We have a pharmacist that once we identify the patient, we discuss the options of the program, make sure the patient's willing to participate in the program. We try to describe the benefits of the program. We describe how it will help us and help them and improve their health. So we have several ways that we consent the patient. We can get a verbal consent. We can have them go through our blue bag program. The blue bag program allows them to take a identified bag, put all of their medicines, all of their home sort of remedies in a bag to bring back to our pharmacist so that they can go through the program, go through the prescriptions and go through their medicines with them. We have developed a care plan which we have talked to the pharmacist about and have developed a program to where they can implement this care plan. And so once we've identified, right now we're using diabetes as our primary care plan, and they can identify the regimen they want to take and educate the patient. As far as reports that we are able to give to the pharmacy and the pharmacy able to give to us, of course we send and identify the patient, we send that to the pharmacy, and the pharmacy is able to, through a partnership, is able to enter the data right into our EMR so that we're able to review that after they have entered it. It goes right into the patient chart and we're able to find it easily. As far as the quality payment program and as far as reimbursement for our medical practice, as far as the ability for our practice to provide care in the future, we're going to have programs such as this to succeed, to survive. It is getting more and more difficult, as everyone knows, to provide care. It's getting more difficult to provide extra resources. This is an avenue that is going to, hopefully allow us to continue to provide that. This is an avenue that we have needed for a long time. The ability to partner in this way with certainly a pharmacist and a pharmacy that cares about our patients is going to be just a win-win. The benefits of the patients of the program are they have better health and better health outcomes. They have better control of their diabetes. They have better access to pharmacists who can go through their medicines, who can tell them side effects, who can tell them how to take their insulin, how to store their insulin, how to administer their insulin. As much as we try to educate in the office, we don't have a lot of time sometimes to go through that. So this is just an extra resource on top of whatever we're able to develop so that they have an extra person trying to help them control their disease. The benefits to the practice are easily identified. Clearly, this is a billable event, which that's important to us because it is time that we have to spend. The most important benefit to the practice, of course, is that the patients do better. In rural primary care now, there is just a complete lack of options for patients. Patients have, I think, have more medical problems, have less access to, say, pharmacists, dietitians, and now this is an avenue that they're going to have that can provide that that can provide that resource, that can provide that contact, that provides that on a timely basis, that can certainly improve their health. Any advice I would have to new practices who are looking at chronic care management is that partner indeed with a local pharmacy. You're going to have people that are more interested in their patients. You're going to have people that are committed to their patients. The benefits of the patients are easy. Anytime you've got more people looking at what the patient is doing, more people identifying problems that could happen with more medicines, the patient's going to do better. So I say, this is a resource that's provided. This is a resource that is available. This is a resource that is compensated. It's just a win-win for everybody.